individuals, the organizations we work in, the government, have in correcting this inequality? And what I'd like to do is throw that question out to all of you to answer, maybe starting with you, Ms. Pace.
Well, thanks for that question, Amy. You know, I guess I want to circle back to some of the comments I made earlier about being an only, and it's, you know, it's somewhat cliche to say, but I think it still rings true. I would much rather be the norm than the exception, right? Someone without a medical degree, but still with a strong public health background, who cut her teeth in community, right? Showing up and really providing a different perspective to the way we approach this work. It's great to know that this particular administration sees that as valuable. And I think there are many more like me across the Biden-Harris team, and yet there are even more of us, of people like me behind me, right? And I would love to have them be right beside me. And so I think making sure we have that pipeline and do the care and feeding required so that those people can be in place is critically important. More than an advisor, as humbled and honored as I was to have that role, I think it's great to also be an appointee, right? And to have some permanence to how we include people. And there are groups like Women of Color in Peace and Security, and other initiatives that are looking not only at the sort of leadership level as traditionally defined, but also identifying emerging leaders, I guess is the term people use, right? Or people who are sort of coming up the ranks. So that leadership comes through in all kinds of ways, as those of us know who have, been living and breathing this work. As Jill was saying, I mean, it's all a matter of perspective. And so I think recognizing, kind of shifting our lens when it comes to who leads and how is really one important way to break through. And I'm grateful we have something in place like the Equity Task Force, but also the White House Gender Policy Council, who I think is going to be looking at, unpacking ways we can truly address some of the barriers Julie talked about, but then put in place some real on-ramps for women to take the lead.
I like the on-ramps idea. Dr. Jim, your thoughts?
Well, thank you for that, Loisa. I'll add to yours, and I do appreciate that comment around just understanding that the recognizing of us being in these roles is one step, is being chosen or have paved the path for some of our own individuals that we didn't know. I think we're paving the way. I think there's young people that are looking at us as we're developing or have been in these positions for a while. So I hear that a lot in the presentations I have done. So I think we may not realize it, but I think we're role models for other individuals. And I'm thankful for that opportunity to encourage not only younger individuals for Native American communities to understand there's a role for us in public health, and also a lot of the work that us here that are doing more scientific roles or epidemiology, things that might have seemed foreign to them in these marginalized communities, as you mentioned. And so I think there's just a recognition that that we can operate and function in these roles. So and just empowering women and younger girls to realize that they can achieve that. And so I think that's one thing, but I think that organizations and our organization or our government, and I'm thankful for our leader in recognizing, balancing women leadership in our government. And so that's one role, is to have support from leaders that are males and another gender, or to realize that and understanding that and empowering us as a government to have that representation. So I think that will be just a case-by-case basis, but if that can be achieved in the organizational culture of an institution, I think that's highly valuable for women to strive and realize too they can break boundaries and do things beyond and what they're capable of doing. So I think I would just add to those comments around just organizational culture and a shift in that. And I think it's happening in this administration. So I'm definitely appreciative of that. Thank you.
Thank you. And you raised an issue that we haven't actually mentioned before, which is the importance of male allies, right? Men who are helping to support this transition, helping to ensure that they're also using their power, their privilege to be recognizing talented women, giving them the floor, giving them the opportunities as well. Dr. Marita.
So it's interesting. It's a great question. I'm a domestically oriented person to begin with, but when I thought about this question, I was thinking there's the international approach, which I just read, Half the Sky, which was just such a powerful book in terms of really underscoring the need to focus on education and economic empowerment internationally. And I feel like that just has to be said, because I think those are the kinds of things that really allow women to become engaged in the workforce and then also to become leaders. And so I feel like those kinds of things are really important at an international level. From a domestic level, though, I think I am really increasingly focusing on the policy changes that need to happen to really allow women to be able to contribute to the workforce in a meaningful way and to have the opportunities to actually lead. Because unless you have a foot in the door in terms of the workforce, you really can't have the opportunities to lead. And so I think, there's government policies that I mentioned earlier in terms of paid leave or supports for caregiving that are just critical, that I think need to happen and need to be sustained beyond just the public health emergency. I think the other thing I would say is things like from an organizational perspective, there's workplace policies and practices that equally affect a woman's ability to stay in the workforce and also to have opportunities to lead. And those are things like the paid leave, again, caregiving supports within a workplace, pay policies, promotion policies, hiring policies. Those are all things that really need to be looked at, assessed, and investigated to understand, are they disproportionately favoring men? Are they hurting women? Do we really all have equal opportunity or a fair opportunity to really rise up and to become engaged meaningfully and also leaders? And then at an individual level, I think it's on us as women who have the opportunities to lead, have been not, maybe I shouldn't say given the opportunities, but who have been able to have these opportunities, that we're actually play roles in terms of mentorship. That's really, really important, that when those of us that have these opportunities really do need to share our experiences with others so they can too also have these opportunities. To focus on recruitment and hiring and retention when you are in positions of leaders. And when I reflect back on my time at the health department in Chicago when I was commissioner, my leadership team was primarily women. And people would tease us when we go to city council, they say, do you even hire men? And it wasn't even something that I did intentionally, but I think we have this, women leaders attract other women. And we have this ability at that time to actually promote and lift up other women. And we really do need to take that seriously and take advantage of those opportunities. And then the other thing I would say at an individual level is I think it's really important for us to vote, because our policies are made by government. And when you look at women representation in government, you can see that we are underrepresented. Only about 25% of Congress is women. And we represent 50% of our population, more than 50% of our population. And so it's really important that we as individuals vote and think about who we're voting for, because those individuals are the ones who actually help to influence the national policy and at the state and local level as well. So I think that's something I would challenge folks to actually think about as a tool that we have within our own ability to actually get out there and vote.
Yeah. Very good point. Using our own voices in the workplace as individuals and also as voters in our society. Dr. Gounder.
Well, you mentioned male allies, and I think this is a really interesting question. Julie and Lois and Jill have done a really good job of describing what women can do, what government systems, structures can do, what structural change is needed. I think male allies could do a better job. And I think there are many men who profess to be allies. And yet I can tell you, with some of the other hats I wear as a medical journalist, as one of the organizers of TED-Med, the medical branch of the TED Talks, I have been in a position to interview many people, to invite people for events. And I won't say never, but it's very rare for a man to say, you know what, are you sure you want me? Don't you want so-and-so. And yet when we invite somebody who is a woman or a person of color, the number of times that they will say, no, are you sure you don't want, XYZ, their PI maybe, or somebody they work with who's a white male. That happens a lot. I think there's also, I think there could be done more done to promote colleagues who are not being asked. I think very often what happens is you invite the person who's most obvious, and it's a vicious cycle where that person keeps getting invited over and over and over again. And you're not recognizing other people who may be just as good, if not better, frankly, in many cases, to speak or work on the topic of interest. There's also something I would call sort of another version of this, Zoom politics. And it's been very interesting over the course of the last year, the number of Zoom meetings that we're in. And I think the way in which people feel entitled to speak and be heard is very different for men and for women. The number of meetings I've been in where you politely, use the Zoom function to raise your hand, and yet the white men who profess to be allies will just talk over everybody because they think what they have to say is so much more important. And that's something where male allies really do need to change. And that is not on us to change them. Having worked in global health for many years, for really from the time I was right out of college up until 2012 or so with the Ebola epidemic, I guess 2014. Worked in tuberculosis and HIV in sub-Saharan Africa for many years. And the dynamic I observed in that setting is you had many women who would get churned through doing the hard work, would do the work over their 30s and 40s. And then by the time they hit 50, had hit, for whatever reason, for personal reasons, for professional reasons, left the field. And I think it's because they're not well enough supported, whether it's with their child caregiving roles or the care of elderly parents who are sick, that all of that tends to fall to them. And all of the credit in these settings often goes, again, to the PI, who is very often a white male. And I think it's problematic because then you talk about the global health workforce. We need to set an example. And so when you set that as the example, that is the hierarchy, that is who is valued and who's valuable, that sends a message to the rest of the world too, working in those settings. And so I think that's something that really does need to change.
Absolutely. And given the amount of funding that also flows through these PIs to kind of partners in countries, it's not just sort of modeling it, it's actually reinforcing it through the power of money and who makes the decisions.
Well, and just quickly on the PI question, I think there are real issues with the funding model. It's very much a winner take all model of funding, the way, for example, your NIH score is calculated. And so the person who has gotten money before will get more money over and over again. And that really does leave out women and people of color, in part because they tend to be the younger, they tend to be more in the younger cohorts coming up. And we have a real problem in terms of the obstacles now, barriers to younger investigators because of the NIH funding system.
Yeah. Well, interestingly, we had a whole discussion with male allies, and one of the terms that got coined was this, the art of leaning out, right? And they made the point that how can women, and particularly we have a colleague, Dr. Madhu Pai at McGill, who was making this point that how can women possibly lean in when all the real estate is already taken up by these men, and that men have to be creating more space for women to have these opportunities. And it was really interesting to be listening to that. I want to thank you. This has been such a rich and thoughtful kind of conversation, and it's really an honor to hear your insights on the pandemic and going way beyond. I do want to make sure we can go to a couple of questions from our audience. So we have a number of really good ones. Perhaps one for you, Dr. Jim. Can you talk about the success of the pandemic response in Native American communities, including the vaccine rollout?
Yeah, thank you for that question. Well, I can definitely point to the vaccine rollout, and I early on when the transition was still happening, we began talking about the possible barriers and challenges on meeting that projected 100-day, 100 million doses. And I think for the healthcare system at the time, we were getting our vaccines, and it's really related to how the healthcare system is structured. External, often Navajo Nation or tribal communities, you end up dealing with pharmaceutical, I guess, areas like CVS and Walgreens and different places, and the federally qualified healthcare centers and the local health departments and state health departments operating vaccines. But in Indian country, there is only one source of healthcare system. It's similar, I guess you could say, to a single payer system, such as the VA. So accessing and responding to the pandemic was, I think, that played a larger role. For once, I think Indian Health Service distributing the vaccine was very successful. We do still have challenges with some tribal communities where they opted to go through the state instead of the Indian Health Service as a distributor. So I think just the acknowledgement of giving a choice to tribal communities, but beside that point, I think having a healthcare system in that form, I think helped a lot, because you can only go to one source, and if they're the distributor, they receive, they were the point of contact or the point of distribution for these vaccines. So, and the health records are often maintained there. So I think I would lend that to the success of this is just the way the systems are set up. The system is set up for Indian country and Native American, but the only challenge with that is the urban Indian communities. There isn't that sort of access to a lot of metro areas and larger areas. So that was a challenge as well. It has been successful, but also I believe that Native Americans were receiving a far much and Navajo a vaccine sooner than everyone else, so we were getting a flux of that. But I think I would point that out as just the healthcare system, the way it's structured. And thank you.
Yeah, great, thank you. I think we have time for one more question, which this may be something that a couple of you want to respond to. So COVID has highlighted deep-set challenges and inequalities. Do learnings from the pandemic also offer us opportunities to think and talk about what effective leadership is in a different way? Anyone want to?
I could jump in maybe, and then others can chime in. For the pandemic really has laid bare the structural inequities that have led to disproportionate impact of the pandemic on communities of color and low-income communities. And I think what we're seeing in terms of successes, in terms of vaccine rollout or testing, good responses from a testing perspective, or public awareness campaigns in general, is those that are really involving the community. So I think that's not something that was done as well in the past, where dollars are actually flowing from the federal government to state and local health departments to actually engage with community, to address vaccine issues, to address testing, contact tracing types of efforts. And those kinds of responses are doing better because they're actually being informed by the community. It's not a top-down approach exclusively. It's really engagement, listening. I think Lois, maybe, or Jill mentioned the importance of listening to community, to hear what their concerns are and to have their input to inform the responses themselves. And I think if there's a lesson to be learned, number one, well, there's two. The structural inequities are the primary thing, listing those up as challenges and needing to be addressed long-term. And then on top of it, solutions that are successful will be those that are informed by those that are affected by the disease or just in general, the community itself. So I think that I think I'm hopeful that will change the way that we lead in the future.
I agree completely, acknowledging that grassroots leadership, right? And that community-based power is critically important. And if we haven't learned that after this past year, I'm not sure when we will, right? I think as noble as you know, both local or state and national governments, I think, tried to respond to the pandemic worldwide, as noble as those efforts were, I should say. I think we really saw the coming together of, of communities. And I think where we saw people shine was in this recognition of our shared humanity, right? And in our resilience, sure. But I think first and foremost, our solidarity and ability or necessity to come together and support one another. And so it is my hope that that experience solidifies the importance of those actions and of those relationships, so that we can lean on those in support of the public sector, as Julie's saying. So I really very much appreciate the question and her response to that.
Thank you. Dr. Gounder, Dr. Marita, Dr. Jim, and Ms. Pace, I so value your perspectives on the importance of diversity and equity, including women and women of color in health decision-making bodies and advisory boards. We can't expect equitable health outcomes if people of all genders, all backgrounds, all identities are not represented at decision-making tables. And taking that intersectional lens to COVID-19 and frankly to all health issues is crucial for progress, both in terms of health outcomes and closing the gender leadership gap. You have given us so much to be thinking about as we continue to move towards our post-pandemic future, which we can start to see in the horizon, and think about how we don't just return to normal, because frankly, normal wasn't good enough, but how we create this fairer, more just world for all of us. So thank you so very, very much for joining today's conversation.
Thank you.
All right, we are no longer live on YouTube.
Great. Thank you all so much. That was really great. I wish we'd had more time to be